Today we are going to learn about a bone of the leg, that is the tibia. Tibia is the medial bone of leg, fibula is the lateral bone of leg, tibia is the stronger and larger bone among the two. Here is the bone tibia and here is the bone fibula, and this is how both these bones are articulated to each other, forming a superior tibiofibular joint and an inferior tibiofibular joint. Both these bones, tibia and fibula, are homologous with the ulna and radius of upper limb. Coming to the main parts of tibia, as usual with every long bone, tibia also consists of three parts: an upper end, a shaft and a lower end. So this broader expanded part is the upper end and this narrow part is the lower end, and there is the intervening shaft. Now let's see the side determination of the bone tibia. First of all, how to distinguish between the upper end and the lower end. As told earlier, the upper end is broader while the lower end is smaller. So the lower end is smaller than the upper end. Now the lower end consists of a strong and stout process, this process which you see here, and this process is called as the medial malleolus. And this strong process, it projects from the medial side of the lower end. So this medial malleolus, it should project from the medial side of the lower end. So when you hold the bone in anatomical position, this medial malleolus should be projecting from the medial side of the lower end. Now the next point is that the anterior border of the shaft is sharp and prominent. So here is the shaft, and this is the anterior border of the shaft. You can see a sharp border here, a border which is sharp and prominent, and it is the anterior border. So when you hold the bone in anatomical position, you have to hold it in such a way that this sharp and prominent border, it should face anteriorly. So altogether, holding the bone in anatomical position with all the side determination points, first of all, the upper end is broader while the lower end is narrow, and then in the lower end there is this stout process called as medial malleolus, and medial malleolus should project from the medial side of the lower end, or in other words you can say that you have to hold the bone in such a way that the medial malleolus projects to the medial side. Then the third point is that the anterior border of the shaft is sharp and prominent. So this sharp and prominent border, it should face anteriorly. So concluding all the side determination points, you can say that this is the left side bone, left side tibia. Next, we are going to see in detail about the different parts of tibia. First of all, about the upper end. So here is the upper end. This much part forms the upper end. Upper end is expanded transversely. So right here you can see it is expanded transversely. So this is the anterior aspect of the upper end, and this is a posterior aspect. And upper end consists of further three parts. These are the medial condyle, the lateral condyle, and the tuberosity or the tibial tuberosity. So here comes the medial condyle. This bony mass which you see here, it is the medial condyle, and here comes the lateral condyle. This bony mass is the lateral condyle, and here comes the tibial tuberosity. There is a triangular area here, and it is the tibial tuberosity. Now let's see each of these parts in detail. First of all, about the medial condyle. So here is the medial condyle. This bony mass is the medial condyle. Medial condyle is called so because it is located medially, and medial condyle, it is larger than the lateral condyle, and medial condyle, it is located medially and it corresponds with the medial malleolus. Now there is an upper articular surface present in the upper surface of the medial condyle. So here is the upper surface of the medial condyle, and you can see one articular surface here, and this articular surface is called as the upper articular surface of the medial condyle, and this upper articular surface, it is concave and it is smooth and it is oval in shape, and it articulates with the medial condyle of femur. So here is the bone femur, and here is the lower end of femur, and this is the medial condyle of femur, and here is the medial condyle of the upper end of tibia, and this medial condyle of the upper end of tibia articulates with the medial condyle of femur, this way. And now you can see that the other one, the lateral condyle, it articulates with the lateral condyle of the lower end of femur. So here is the upper articular surface, the concave and oval shaped upper articular surface of the medial condyle. And now the anterior margin, medial margin and the posterior margins of this articular surface, it is related to the medial meniscus or the medial semilunar cartilage of the knee joint. So these margins are related to the medial meniscus or the medial semilunar cartilage of knee joint. And lateral margin, here is the lateral margin of the upper articular surface. In the lateral margin, you can see a tubercle. The lateral margin, it projects upwards to form a tubercle here, this tubercle here, and that tubercle is named as the medial intercondylar tubercle. So the lateral margin of the upper articular surface of medial condyle projects upwards to form the medial intercondylar tubercle. Here is the medial intercondylar tubercle. The semimembranosus muscle, it is inserted to the posterior surface of the medial condyle. So to the posterior surface of the medial condyle comes the insertion of the semimembranosus muscle. Next is about the lateral condyle. So here is the lateral condyle. This bony mass is the lateral condyle, and lateral condyle, in the posterior surface of the lateral condyle, there is a small rounded facet. It is called as the fibular facet, which articulates with the head of fibula. So here you can see a small rounded facet here, and it is called as the fibular facet, which articulates with the head of fibula to form the superior tibiofibular joint. So here in this specimen you can see the fibular facet more clearly. This is the fibular facet. Now here is the bone, tibia and fibula of left side, and here is the lateral condyle of the upper end of tibia, and here is the fibular facet of the lateral condyle, and this fibular facet articulates with the head of fibula forming the superior tibiofibular joint. So here is the bone fibula, and here is the head of fibula, and head of fibula consists of a circular facet on its upper end. This is the circular facet present on the upper end of fibula, and this circular facet articulates with the fibular facet on the lateral condyle of tibia to form the superior tibiofibular joint. So this circular facet articulates with the fibular facet present in the upper end of tibia to form the superior tibiofibular joint. So this is how the superior tibiofibular joint is formed. Now here is the upper surface of the lateral condyle, and here also there is one upper articular surface, and this upper articular surface is concave and it is circular. So remember, the upper articular surface of the medial condyle was oval in shape. Here the upper articular surface of the lateral condyle, it is circular in shape, and its margins are related to the lateral meniscus of the knee joint. The margins of the upper articular surface of the lateral condyle are related to the lateral meniscus of the knee joint, and the upper articular surface of lateral condyle, it articulates with the lateral condyle of the lower end of femur, which we have just seen. Now here in the anterior surface of the lateral condyle, you can see a oval impression here, and this oval impression, it gives attachment to the iliotibial tract. Then another important muscle which gets inserted onto the lateral condyle is the biceps femoris. Few fibers of biceps femoris are inserted to the lateral condyle. Now here is the upper articular surface of the medial condyle, which is oval in shape, and here is the upper articular surface of the lateral condyle, which is circular in shape. And in between the upper articular surfaces of the two condyles, there is a rough non-articular area. Here is a non-articular area which is rough, which consists of elevations and depressions, and this non-articular area in between the upper articular surfaces of two condyles is called as the intercondylar area. So this is the intercondylar area, and this intercondylar area consists of an elevation in the middle part, and this elevation is called as the intercondylar eminence. So, in the middle of this intercondylar area, there is an elevated area which you find here. There is an elevated area present in the middle part of the intercondylar area, and this is known as intercondylar eminence. So, intercondylar eminence is a eminence or elevation present in the middle part of the intercondylar area. And you can see two tubercles present in the intercondylar eminence. So, these two tubercles present in the intercondylar eminence, and these two tubercles are present at the lateral and medial parts of the intercondylar eminence. So, once again, here is the intercondylar eminence, which is a elevation present in the middle part of the intercondylar area. And this intercondylar eminence consists of two tubercles present at its medial and lateral parts, and these two tubercles are the lateral and medial intercondylar tubercles. So, this one is the medial intercondylar tubercle and this one is the lateral intercondylar tubercle. Now, this one is the medial intercondylar tubercle and this one is the lateral intercondylar tubercle. The intercondylar area gives attachment to the ligaments and menisci of knee joint. These are the anterior horn of medial meniscus, also called as the semilunar cartilage, then the lower end of anterior cruciate ligament, the anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, and the lower end of posterior cruciate ligament. You can note the positions of attachments of these ligaments and menisci from this picture. Apart from this, the posterior aspect of the intercondylar area gives attachment to the capsular ligament of knee joint. Next is about the tuberosity of tibia or the tibial tuberosity. So, here is the tibial tuberosity. This triangular part is the tibial tuberosity. Tibial tuberosity, it lies at the upper end of anterior border of the shaft and at the place where the anterior surfaces of two condyles become continuous. So, the tibial tuberosity, it lies at the upper end of the anterior border of the shaft. So, here is the shaft and we have seen the anterior border of the shaft which is sharp and prominent, and this anterior border, when you trace upwards, the tuberosity of tibia lies at the upper end of the anterior border of the shaft at the place where the anterior surfaces of two condyles become continuous. So, here is the medial condyle and here is the lateral condyle. The anterior surfaces of the medial condyle and lateral condyle become continuous at this point where the tibial tuberosity is located. And the tibial tuberosity is triangular in shape. It consists of two parts, an upper smooth part and a lower rough part. So, here is the upper smooth part. You can see this part is smooth and shiny, and here is the lower rough part. You can see this part is rough with muscular impressions. So, this is the upper smooth part and here is the lower rough part. This upper smooth part, it gives attachment to the ligamentum patellae, and this lower rough part, it is subcutaneous. You can feel it right under the skin, and it is separated from the skin by the subcutaneous infrapatellar bursa. Now that we have finished the upper end, let's look into the shaft. The shaft consists of three borders and three surfaces. The three borders are anterior border, interosseous border and medial border. And the three surfaces are medial surface, lateral surface and posterior surface. First of all, let's look into the borders. So first about the anterior border. We have already seen the anterior border when we discussed the side determination. The anterior border is sharp and prominent and it faces anteriorly, and the anterior border, it begins below the tibial tuberosity. So here is the tibial tuberosity, the triangular tibial tuberosity, and the anterior border begins just below the tibial tuberosity and it comes down as a sharp prominent border and it ends below at the anterior margin of the medial malleolus. So here is the medial malleolus. This stout process is the medial malleolus. So the anterior border, it starts from below the tibial tuberosity and comes all the way down here, and here it actually deviates to one side so that it becomes continuous as the anterior margin of the medial malleolus. So down here the anterior border, it becomes continuous as the anterior margin of the medial malleolus, and here the anterior border ends here as the anterior margin of the medial malleolus. Then the anterior border is subcutaneous, it is sharp and prominent, and it is called by another name called as shin. Now next is about the introitious border. In tibia, introitious border is the lateral border. Introitious border is also called the lateral border. And introitious border, it begins from below the fibular facet. So we have already seen the fibular facet which is present in the posterior aspect of the lateral condyle. So this small facet, and slightly below the fibular facet, from here the introitious border begins and it comes down, it extends below to reach the anterior border of a notch present here at the lower end. So here is the lower end of tibia, and in the lower end here there is a notch, and this notch is called as fibular notch, to which the lower end of fibula is articulated to form the inferior tibiofibular joint, and the introitious border down here, it extends up till the fibular notch. So the introitious border, it begins from below the fibular facet present on the lateral condyle, and it comes down, it extends below like this, and it comes down and ends near the fibular facet present in the lower end. So this is the introitious border, and it gives attachment to the introitious membrane. Next is about the medial border. The medial border, it begins below the medial condyle. So here is a medial condyle, and the medial border begins below the medial condyle, and it runs down here, and it extends down to the posterior margin of the medial malleolus. So here is the medial malleolus, and this is a posterior aspect, and this is the posterior margin of the medial malleolus. So the medial border, it extends down till the posterior margin of the medial malleolus. Now a few fibers of semimembranosus muscle gets inserted to this medial border, and medial border also gives origin to soleus muscle. Now the borders are over. Let's see about the surfaces. So there are three surfaces: medial surface, lateral surface, and posterior surface. First of all, let's see the medial surface. So here is the medial surface which you see right here. The medial surface lies between the anterior border and the medial border. So here is the anterior border, and here comes the medial border. So in between the anterior border and the medial border, this is the medial surface. And medial surface, it is subcutaneous throughout. The medial surface, it gives insertion to the following muscles. These are the semimembranosus, the sartorius, the gracilis, and the semitendinosus. Next is the lateral surface. This is the lateral surface. The lateral surface lies between the anterior border and the introitious border. So here is the anterior border, the sharp prominent anterior border, and here is the introitious border. So in between the anterior border and the introitious border, and this is the lateral surface. The lateral surface gives origin to the tibialis anterior muscle. Next is about the posterior surface. The posterior surface, it lies between the introitious border and the medial border. So here is the introitious border, and here comes the medial border. So in between these two borders, this is the posterior surface. Here is the posterior surface. And in the posterior surface, here in the upper part of the posterior surface, you can see a rough oblique line here, and this rough oblique line is called as soleal line. The soleal line, it starts a few centimeters below the fibular facet, and it runs downwards and medially to the medial border. So this is the medial border, okay, and this is the interosseous border. This is the interosseous border, and here is the soleal line. Soleal line is a oblique line present in the posterior surface, and this line, it starts few centimeters below the fibular facet. This is the fibular facet. Below the fibular facet, there is a starting of the soleal line, and the soleal line, it starts from there and it runs downwards and medially to reach the medial border, okay. And now this soleal line present on the posterior surface, it divides the posterior surface into two parts, an upper triangular area and a lower area. So this is the whole posterior surface, and this soleal line, it divides the posterior surface into an upper triangular area and a lower area. This soleal line, it gives origin to the muscle soleus. Now, this triangular area above the soleal line, it gives insertion to the muscle popliteus. Now, the area below the soleal line, this area, it gives origin to the muscles flexor digitorum longus and tibialis posterior. Now, we have finished the upper end and the shaft. Let's look into the lower end. So, here is the lower end of tibia. This much part is the lower end. Lower end possesses one process, that is the medial malleolus. So, this stout process which projects down is the medial malleolus. And then lower end consists of 5 surfaces. So, holding the bone in anatomical position, the 5 surfaces of the lower end are, here is the anterior surface and here is the posterior surface. Then here is the medial surface, then here comes the lateral surface, then here comes the inferior surface. Here is the anterior surface and here is the posterior surface, and here comes the medial surface, and here comes the lateral surface, and this is the inferior surface. First, let's see about this process, the medial malleolus. The medial malleolus is defined as a short, stout process which projects down from the medial part of the lower end. So, it projects down from the medial part of the lower end, and medial malleolus, it possesses 4 surfaces and 1 border. So, hold the bone in anatomical position. The surfaces of the medial malleolus are, here is the anterior surface, here is the posterior surface, here is the medial surface, and here is the lateral surface. This is the lateral surface. The 4 surfaces of medial malleolus. This is the anterior surface, here is the posterior surface, here is the medial surface, and down here is the lateral surface. And now one border is called as the lower border, and this is the lower border, the lower border. Now among this, the medial surface, it is convex and subcutaneous. So it is convex and it is subcutaneous. You can easily feel the medial malleolus at the medial aspect of your ankle joint. Then the lateral surface, this is the lateral surface. The lateral surface consists of a comma-shaped facet which articulates with the body of the talus, forming a part of the ankle joint. So this facet which you see here, it is the comma-shaped facet which articulates with the body of talus, forming a part of the ankle joint. And here is the anterior surface of the medial malleolus, and this is the posterior surface. The posterior surface of the medial malleolus gives attachment to the flexor retinaculum. Now we have finished learning about the medial malleolus of the lower end. Now let's look into the surfaces of the lower end. As I told earlier, there are 5 surfaces. First of all, let's see about the anterior surface. So here is the anterior surface of the lower end. The anterior surface, it is continuous above with the lateral surface of the shaft. So here is the lateral surface of the shaft, and here comes the anterior surface of the lower end. This anterior surface of the lower end, it is continuous above with the lateral surface of the shaft. So remember, the lateral surface of the shaft, it is the surface which is located between the anterior border and the interosseous border. And you have to remember that the anterior border, the lower extent of the anterior border is such a way that in the lower part the anterior border becomes continuous as the anterior border of the medial malleolus. Okay. So the anterior border down here, it deviates to the side of the medial malleolus so as to become continuous with the anterior border of the medial malleolus. So that is how this anterior surface becomes continuous above with the lateral surface of the shaft. Now the anterior surface gives attachment to the capsular ligament of ankle joint. Next, let's see about the medial surface of the lower end. So here is the medial surface of the lower end. The medial surface, it is continuous above with the medial surface of the shaft, and it is continuous below with the medial surface of the medial malleolus. Okay, so this is the medial surface of the lower end. It is continuous above with the medial surface of the shaft, and it is continuous below with the medial surface of the medial malleolus. Next, let's see about the posterior surface of the lower end. So this is the posterior surface of the lower end. The posterior surface, it is continuous above with the posterior surface of the shaft. Okay, so the posterior surface of the lower end, it is continuous above with the posterior surface of the shaft, and this posterior surface, it gives attachment to the capsular ligament of ankle joint. Next, about the lateral surface. So here is the lateral surface. In the lateral surface, there is a notch which we have already seen. It is the fibular notch. So fibular notch is present in the lateral surface of the lower end, and this fibular notch articulates with the lower part of the posterior surface of the shaft of fibula to form the inferior tibiofibular joint. Now here is the articulation of tibia and fibula, and here is the inferior tibiofibular joint, and you can see that here is the fibular notch present at the lateral surface of the lower end of the tibia, and to this fibular notch articulates the lower part of the posterior surface of the fibula to form the inferior tibiofibular joint. Next, let's see about the inferior surface. So here is the inferior surface of the lower end of tibia. This surface articulates with the superior surface of the body of talus, and this surface medially, it is continuous with the articular surface of the medial malleolus. So remember, this is the comma shaped articular facet present at the lateral surface of the medial malleolus, and this is the inferior surface of the lower end of tibia. This inferior surface, it is continuous medially with the articular surface of the medial malleolus. That's all about the bone tibia. I hope you all enjoyed this video. Thanks for watching.